So there are different, the lungs are divided into 10 different further divisions, and these divisions are called bronchopulmonary segments. Bronchopulmonary segments. So these divisions are called bronchopulmonary segments, and let me draw, like each lung has 10 bronchopulmonary segments. So the left one has 10 segments and right one has 10 segments. So in exams it is like really important that you know how to draw the segments of the left and right lung. So from the, this is the lateral view of both lungs, so I'll basically draw the segments of left lung. So these are the, including this one, these are the 10 bronchopulmonary segments of the left lung. So this is very very important. In every exam you have to draw these segments. And moving towards the left right lung, this is your typical right lung. So talking about, so as we already drew earlier, there are two fissures. One is the oblique fissure and one is the horizontal fissure. There are three lobes of the lung, three parts. This is the right lung. So these are the bronchopulmonary segments of the right lung. So the clinical aspect of why do we need to study these bronchopulmonary segments is that one interesting thing about these segments is that these segments are like functionally independent parts of the lungs. So like what does that mean is that even if like you remove, say, suppose I remove this top segment, and the lung is like this top segment is removed. Even if I remove this top segment, the lung will function normally. So these segments are not like functionally related to each other, these can function independently. So it is very useful in surgery because during lung cancer, so bronchial carcinoma, if this part of the lung is like is affected by lung cancer, so this medial part of the lung is like affected by the lung cancer, then what the surgeon can do is he or she can uh, simply remove this part, like do, it's called, the procedure is called lobectomy. So he or she can basically remove this part of the lung altogether. So after that the lung would look like this. So this part of the lung is removed. So what does that do is like this reduces the case, like chances of this cancer to spread to other parts of the lung. So if the condition is diagnosed earlier, then the cancer affected part or the bronchopulmonary segment, the segment of the lung can be removed, the affected segment can be removed to prevent the spread of cancer to the other parts of the lung, and the person can be saved.